All right, I am on with Doc Swiner. It is our self-care Friday. Thank you, Doc Swiner, for joining us. We love having
Absolutely.
you.
Absolutely.
Love, love, love. You're
Anything for Kay Clark.
anything for me. Oh my
Wait,
good.
wait,
Wait, she's like, wait,
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 wait.
hold on. Calm
Most
down, Karen. Calm down. Most anything. So we wanted to start this segment called Self-Care Fridays because number one, self-care is important, but number two, it seems like it's become a buzz phrase, especially during the pandemic. There are people that have been executing self-care, but it wasn't talked about like on the news, on talk shows, and now it's everywhere. So we thought, what better than to bring on the best doctor we know, Doc Swiner, to talk about self-care and give us ideas of self-care. So let's start it out like this. What in the world is this self-care thing that everybody's talking about all the time?
yes. Well, self-care is my jam. I've
Mm,
I've been championing, is that a word? Championing?
championing. Yes,
This
that's the word.
preaching about cheering folks on in terms of self-care for a couple of years, with the whole no superwoman thing movement that I talk about. But self-care essentially is, just to kind of put it all under one umbrella, is anything or a collection of those things that make you feel rested, less stress, and essentially giving yourself permission to focus on what you want and what you need at that moment. And hopefully it's something that you do consistently. Hopefully it's not every quarter, or only once a quarter, or once in a while, that you're doing something that makes you feel good, makes you feel fulfilled, gives you rest. But you're doing it consistently. You're making it your lifestyle. So that, in a nutshell, is what self-care means to me.
Okay, so give us some examples of self-care because that sounds like mani pedis, it sounds like massages, it sounds like facials. Is it more than that?
It's much more than that. I think when we first started talking about it as a buzzword or as a hashtag, most women, most people did mean those things that are simple yet relaxing. So getting your hair
Mhm.
done, getting your mani pedis, getting your massage, taking a nap, those things, as simple as they sound, really do mean a lot in terms of making yourself feel better, sitting down and having a quiet moment to
Mhm.
yourself. Hopefully, either alone or it's with someone that you enjoy, so that you're not expending your energy in ways that you don't want, but really just focusing on positivity. So it can be as simple as getting a service of some sort,
Mhm.
or it can be
Mhm.
as long term, or as complicated as taking time off, or finding a new job, or getting out of that toxic relationship. We really have expanded
Mm.
the definition to mean things that are a little bit more meaningful and have carry a little bit more weight in your life in general. So it means all those things that are healthy and make you feel good.
Okay, so when I was in the music industry a billion years ago, and I was having a crazy dreams about my job and panic attacks, and my boss wrote on a prescription pad, "No contact with work for 6 weeks." That was self-care, right? I
Absolutely.
guess it was like a healthcare mandated self-care. I did
Yeah,
never think of it like
it
that.
was forced upon you. Yeah, absolutely. And there are a lot of things. There are a lot of things that are changing about the work environment now, both from an employer and employee standpoint, to hopefully make self care part of the workplace. Because I mean, clearly, all of us are stressed out. The pandemic has
Mhm.
been crazy. Especially if you're in healthcare, or you're in the front lines, or you're an essential
Mhm.
worker, it never stopped. It doubled. It tripled. And it became harder and harder because the world was closed to go off and have that mani pedi, or go off and feel safe getting a massage, before we were all vaccinated and all that. So it's
Right.
become, yeah. So it's even more important nowadays to have someone tell you you have to take this moment to focus on yourself, because we need you to come back and be better for the team.
Okay, so let's zero in on a particular type of self care this week. What self care do you want to talk about today?
Well, we can talk about taking some time off and being away from work. If any of you have followed my journey, I certainly have joined what's called the Great Resignation recently.
Mm-hmm. Mm-hmm.
And it was probably my biggest step in my own self-care, and really trying not to be a superwoman, is leaving a position that I've been in for 15 years. And even before that, allowing myself, giving myself the permission or accepting the strong recommendation from my mentors to take time off, to take FMLA, to take short-term disability. And I think it was really, truly life-saving from a mental health standpoint.
Wow. So FMLA could be considered a form of self-care.
Absolutely.
Okay. And as a doctor, you think that taking that time off from a medical standpoint is important? Why?
It's critical. I believe that probably the biggest part I played in this whole coronavirus pandemic for my patients is to be that advocate for them, to write a work letter, to write or fill out the FMLA forms, which stands for Family Medical Leave Act, which is a formal piece of paper and pieces of paper that you get from your human resources, your HR department, that every employer essentially is legally supposed to have to cover folks, so that if you need time off, it protects you, it protects your job, so that you have a position to come back to once you take that time that someone says you are required to take. So I think that was probably my biggest contribution, is helping my patients that either were infected by COVID and had to be off, or however had long-term COVID complications and had to be off, or had stress related to COVID in some way, their family member, or just the pandemic in general. I think I was able to help them get that form signed, get that disability paperwork filled out, get that work letter signed, so that they were able to take days that a lot of us felt either guilty for taking, or we felt we couldn't take. We were essentially being forced or strongly encouraged to return to work too soon, or sooner than we thought we could handle. So I think that was probably my biggest contribution, is helping people take that time that they needed.
That is awesome. I hope this gives our listeners something to think about today, that self-care can be that mani-pedi, that facial, that massage, but it can also be getting with your healthcare provider and arranging to apply for FMLA and have your job protected and take off the time that you need so that you can do what you need to do, refresh, rejuvenate, whatever. Just have some downtime and then be back.
Absolutely.
Eventually.
Yeah.
Or
now,
in your case, not be back.
Or not be, or decide that you want to do something else. Now, I will say, if you have PTO and you have sick leave and you have vacation time, take that first. Because you also, you want to follow the rules, and always refer to your HR department and the rules of the company and the organization that you work for. You just don't want to jump out there and assume, because they also have the ability to approve or not approve your requests. Hopefully, if you have your physician, your mental health provider, your psychiatrist help you fill out the form, they will take that under strong consideration. But your employer does have the ability to say, no, we need you, or no, we only have a week available instead of your 6 weeks. But if you have saved up PTO, if you have sick leave, if you have vacation time that you haven't taken, use those hours, because you want to use it or lose it in most cases, and you still want to get paid during that time. During FMLA, you may not. There's a possibility you might not get paid depending on your organization's rules. But at least if you take the time off, you are guaranteed to still have a job when you get back. So take the PTO first, and then look into your FMLA.
All right. Thank you, Doc Swiner. This is great information. We're going to do this every week. We're going to talk about a different form of self-care. I think it's important. I think people need it right now. And as more people are trying to figure out how to work their way back into the workplace, they might need a little something to help them cope, because it's been a time for all of us.
It's been 2 years. Isn't that crazy?
It's insane. And my calendar popped up the other day. I marked on my calendar my first day out of work 2 years ago, and it popped up the other day. And I was like, wow, this is insane that it's been this long. Yeah. So thank you for doing this. And thank you for helping us talk about this. And Self-Care Fridays, hashtag Self-Care Fridays with Doc Swiner. How do we get in touch with you and follow you, Doc Swiner?
I'm Doc Swiner on almost all social media except IG, Instagram, where I'm at Real Doc Swiner. And feel free to reach out and DM or email me. Most of my websites have my email included as well. So, feel free to reach out there.
All right. We'll talk to you next week. Thank you, Doc Swiner, for talking to us about self-care.
Bye-bye.